Hello, everybody, and thank you for taking the time to watch this presentation about how Congress works. I'd like to introduce myself. My name is Philip Gogos II. I am one of IFFGD's representatives here in Washington. And first, I want to take some time to go over how Congress works. So first and foremost, thank you for participating in our advocacy efforts. Sharing your story is critically important and is a very big deal. You're helping our legislators understand FGIMDs and educating them about the importance of them. You're advocating not only for yourself, but you're also benefiting the larger patient community in sharing your story. First, I want to go over a quick background on Civics 101, why we engage Congress and how the federal government works. First, we have three branches of government. The first is the executive branch, which is the administration. They enforce the laws. You have the judicial branch, which are the federal courts. They interpret the law. And then you have the legislative branch, which is Congress, who we work with, and they create and enact laws and different policies. Now, the reason we work with Congress is because they have the power of the purse. Congress decides how much money each federal agency receives on an annual basis. They also create specific policies, and they provide oversight of all federal agencies. So about Congress. First, you have the U.S. Senate. Each senator is elected to a 6-year term. You have 2 senators from every state, and there are 100 senators in total. So each state, no matter if they're a high population state like California or a low population state like Montana or Delaware, each of those states have the same number of senators too. Now, the House of Representatives, they're elected to 2-year terms, and you have 1 representative from each district. There are 435 districts in total, and as opposed to the Senate, where each state has equal representation, the House, each state will depend on the population. So the state of California has a larger population. They have more members of the House of Representatives, as opposed to a state, again, like Montana or Delaware, who only have 1 member of the House because of their population. Each 10 years with the census, the districts of the House of Representatives are redrawn. The number of representatives will always stay at 435. So you will see in times where a state will lose a few seats or gain a few seats depending on the growth or contraction of their population. Some congressional committees that we work with and focus on the Senate side, you have the Appropriations Committee, which decides how much each federal agency receives in funding on an annual basis. You have the Health, Education, Labor, and Pensions Committee, appropriately the HELP Committee. They have jurisdiction over healthcare issues. They have oversight over a number of federal agencies that we interact with, including the National Institutes of Health and CDC. And then you have the Finance Committee, which has jurisdiction over Medicare, Medicaid, as well as other important health-related issues. On the House side, you also have the Appropriations Committee, which, similar to the Senate side, creates different funding levels for federal agencies, as well as specific recommendations about what they want to see the federal agencies focus on. On the House side, you have the Energy and Commerce Committee, which is the complement to the Senate Help Committee. ENC, the Energy and Commerce Committee, has jurisdiction and oversight over NIH, CDC, and other federal health agencies. And then you have the Ways and Means Committee, which is the complement to the Finance Committee, which serves as an overseer of Medicare, Medicaid policy, tax issues, and other healthcare related issues. Now, what's critical about these committees is in order for a bill to become a law, it must first pass the House and the Senate and then signed by the President. Then it works its way through the committee process before it makes it to the floor of the House and Senate. And we'll talk a little bit more about that when we talk about our bill. The process of committees and bills becoming a law are general. They apply to every single bill that is introduced, and they address those must-pass annual bills, such as the appropriation bills that happen every year. Now, why do legislators support specific bills or advance bills that become laws? It's because of feedback they receive from you, their constituents, about what they should be focusing on. Some of the federal healthcare agencies that we interact with, the National Institutes of Health, which is the premier research agency in the country. You have the Food and Drug Administration, which oversees drug policy and drug approvals. You have the Centers for Medicare and Medicaid Services, which decides specific policy coverage issues. And then you have the Centers for Disease Control and Prevention, which is the public health agency in our country. They've been doing a lot of work recently with the pandemic, as well as what we hope will be continued education and awareness activities for the chronic disease community. Most importantly, what do you do? What do advocates do? Primarily, you educate lawmakers, you raise awareness by sharing your personal stories, you make connection with your local office and the DC office, and you ask for a specific action at the correct time. What I do here in Washington on a daily basis is represent the interests of our community on Capitol Hill. And I could go and visit every single Senate office and House office and ask them to co-sponsor a bill, to support a funding specific level. But what really makes that point driven home and what really spurs action from members is having their constituents reaching out, sharing their stories, and making the ask for them to support our key priorities. We work with a critical mass of support. As an individual with one voice, what you're doing is you are an advocate in a coordinated nationwide grassroots effort. As I mentioned, I can go into every office. What really drives it home is hearing from you, their constituent. Today, we have folks from all across the country who are engaging with their members of the House and the members of the Senate, asking them to support our key priorities. And by becoming and by being an advocate, you are influencing increased research funding and improved healthcare for our community and for patients all around. Now, together as one unified voice, what we do is we educate, inform, and influence legislators. And each of us plays an important role in our goal to find a cure for FGIMDs, working together, increasing awareness across the country. I thank you for taking the opportunity to watch this video. If you have any questions on the content or material, please do not hesitate to email us at advocacy@iffgd.org. Thank you again.